Good afternoon, everyone. For those of you who are joining us for the first time, I'm Donna Duncan, CEO of the Ontario Long-Term Care Association. And for those who tune in weekly, welcome back to our weekly Knowledge Break webinar series. We are delighted today to kick off part 5 of our series, where we will continue to showcase expertise on sector topics, case studies, and other helpful information that can be incorporated into your homes, and by bringing the voice of experts to the fore. For today's webinar, I'd like to acknowledge our Knowledge Break sponsor, CloroxPro, who also happens to be today's guest speaker. Many of you may recall from Wave 1 and last summer where Clorox very generously donated resources and tools and iPads to long-term care homes at some of our nonprofit homes across the province, and been very generous in now spreading their knowledge in infection prevention and control. Who knew that infection prevention and control and IPAC would be one of the acronyms we'd be talking about as we think about how to manage our preparedness in managing through the second wave, and now preparing as we potentially face a third wave and navigate the variants. I'm delighted to be able to welcome Bilal Demarchi, who is the marketing lead for Clorox Canada, together with Barley Chironda, who is going to be speaking with us today. Barley is a registered practical nurse and is the International Infection Control Specialist with Clorox Canada. A little bit about Barley. In his role, he works with hospital staff, patients, and the public on proper infection prevention practices. He also volunteers as the Infection Control Specialist with the C. diff Foundation and is the former IPAC GTA president, as well as the IPAC Canada Social Media Manager. He also has held frontline roles in IPAC management, as well as medical device reprocessing management. So he's an expert. We were chatting just at the beginning of this and saying he's like gold as we think about where infection prevention and control specialization is required. We know that IPAC and proper cleaning protocols have never been more crucial, and we continue to work with the government of Ontario, developing and building on our Wave 2 action plan to make sure we have the tools and the resources, the expertise, the insights, the information and the specialists in our homes on a go-forward basis as we navigate and work to higher standards in infection prevention and control in long-term care homes. So with that, before I pass it over to Barley, a few questions to anchor us, and we hope that those of you who are online can comment on these answers to these questions in the Q&A box. Just want to level set so as we go forward, Barley can speak to your questions, but have an understanding about what your experience and expertise is in working with IPAC tools such as electrostatic spraying technology, which is new and has taken off exponentially through this. And so that he can make sure that he's giving informed answers based on your reality. So a few questions for you to please respond to in our Q&A box. Are you using electrostatic spraying technology? Yes, no. And if you could indicate what product you may be using. What are you using to disinfect for COVID-19? What is the product name and the contact name? What are you using to disinfect for C. difficile? Please state the product name and contact name. What food safe disinfectant are you using? Please state product name and contact name. And with that, gives me a great pleasure to introduce IPAC Specialist Extraordinaire, Barley Chironda. Thank you, Barley.
Thank you. Thank you very much, Donna. I truly appreciate the opportunity to speak and the opportunity to share. And before I even get started, I'm really grateful for the work that's being done in long-term care. And the work by the association and the work by all of you in the front line, because definitely long-term care and the aged settings have been disproportionately hit by COVID, and to know you guys are here and supporting and continuously looking for information, is something that I truly appreciate. With that being said, what I wanted to talk about over the next little while is just the outline as given. I want to talk a bit about the infection transmission and surface disinfection. Then I want to introduce electrostatic technology to some that are not using it at the moment. And then I want to back that up with the clinical evidence as well as what the guidelines are saying, because I believe that this is some foundational work that's going to help you as you're deciding, wait, is electrostatic technology for me? Or should I be using it? And if you're using it, I would love to see even on the chat box as you continue to answer the questions that you're using it. That would be very grateful to see as well. Next slide, please. So infection transmission and surface disinfection is very, very important. And this is some statistics about Canada. What we know right now is over 200,000 patients get infected each year while receiving healthcare. And this is prior to COVID. So obviously when the data starts coming in and trickling in, we'll see a little bit more about this. Of that, 1 in 12 adults and 1 in 10 children admitted to a Canadian hospital develop an healthcare-acquired infections. And healthcare-acquired infections themselves have led to 12,000 deaths per year in Canada, of which we know specifically about C. difficile because that's typically a big problem, and we know how much those have been causing problems with. There are other healthcare-acquired pathogens that are of concern. As you all know, SARS-CoV-2, C. difficile, MRSA, and VRE are some of them. But today I'll talk about all of these and in the context of how we can actually go about minimizing them. But for all you know, regardless of whichever virus or pathogen or bacteria you're looking at here, all of them have been associated with transmission from surfaces and healthcare workers touching those contaminated surfaces. So that's why the surface becomes some important component. Next slide. The issue is once you have a surface that is contaminated, those surfaces become contaminated for a very long period of time. Here's some data that show how long MRSA stays on the surface, which is from days to weeks. C. difficile can stay for months on end, and certain much more dangerous bacteria such as CRE and CPE last even longer. What we also know is with COVID-19, which is caused by SARS-CoV-2, that surfaces have been found to have even contamination up until weeks on end. So anything from hours to days to weeks is really where we're seeing that SARS-CoV-2 can linger on the surface. So this makes the surface a very important thing that we want to make sure that we are actually fighting. There are a couple of different surfaces to think of, and there's different times and frequencies to think of. The issue is you need to get to as many surfaces as you can, as often as you can. And this is where the problem comes about, right? Do we have the time? Do we have the resources? And can we get to every nook and cranny at every point in time? But this is something that comes up, obviously, as you start thinking about this. Next slide. We also know, and we didn't even need COVID-19 to tell us this, but we know outbreaks cost a lot. They cost a lot in terms of management. They cost a lot in terms of the investment. They cost a lot in terms of people not being able to access care. And this is an example of some work that Clorox did to try and understand the cost of an outbreak. And we worked with a couple of different sources. So we looked at a 20-day cost of a norovirus outbreak at a large Ontario hospital, and it cost them $115,000. When we took the same analysis to a larger 946-bed hospital, we noticed that it cost them $650,000 to just manage the same outbreak for the same period of time. And we know year upon year, even prior to COVID, that 1,778 outbreaks were happening. And unfortunately, 62% of those outbreaks happen in long-term care. And that's why it becomes very important. And I'm happy for this platform to talk to you around, hey, what can we do for long-term care and how can we support, bring some of the sophistication that we have in healthcare settings into your setting. And I think that's really what this platform will really allow us to do and really speak to some innovation that you can really apply in this space to help you fight infections from surfaces. Next slide. So, as I said, eliminating the environment as a source of infection becomes the #1 biggest responsibility. And there's many ways this can be done. And I think the fact that there's so many ways this can be done adds a layer of complexity, because then you ask yourself, what can I do? What is best? How can I do this and that? What we know now is standard environmental disinfection procedures either come in the form of using Health Canada approved disinfectant wipes, or in the form of ready-to-use trigger sprays, or lastly, using buckets and dilutable system. Regardless of which method you use here, the studies have been very, very clear that each of these efforts, when it has a human behind them, can lead to 50% of surfaces being missed. And if you're missing 50% of surfaces, and a healthcare worker just touched any of those missed surfaces, that opens up the vulnerability and makes it such that infections will continue to spread. And we've seen this many a time when we go to outbreak facilities and they're continuously going on outbreak and outbreak. And then you realize that it was one surface that was missed. Studies have shown that even a computer workstation missed can continue spreading a virus or a bacteria. So this becomes important to have other strategies. That's why the electrostatic technology becomes an important piece. And on this, so you know, electrostatic technology, by the way, has been used in agriculture when they've been applying pesticides, because you want to get to the bottom and to the top of a plant. And the best way to do that is by having superior technology such as electrostatic. It's also been used in the tanning industry, in inkjet printing, and automotive painting. So this is something that has already been currently used before. The unique part now is we're bringing it into healthcare. And this is really what this discussion is about, and introducing to some of you that this is a new technology that can be used in the context of healthcare. But rest assured, it's existed before in many other industries. Next slide. So, as I said, electrostatics becomes that new way to spray, to apply product. Many of you might be familiar already using a trigger spray either at home or in the workplace. The trigger spray and pump is open to human application, and it does not have the same technology and innovation that electrostatic sprayer does. And I'll talk through that over the next couple of slides. But the key takeaway here is electrostatic sprayer is definitely one of the pieces. Trigger spray is definitely another. But what you're able to do is over and above what you're able to do in a trigger spray. So electrostatic introduces a bit more sophistication. So how does it work? Well, as you could see from the previous image, what you have here is the technology in the form of a gun or application device. Oh, sorry, I'll ask you to go back one more. Okay. And every single droplet that's coming out is electrically charged. So what it does is it's looking to apply, that chemical is looking to apply onto a surface and completely wrap it around. So now you have everything on a surface completely covered. And because of the technology, it doesn't linger in the air, so you don't smell it. It's not like a droplet or mister. It's looking to attract with the force greater than gravity. So this now gives you a bit of sophistication and a bit of an ability to not have anything lingering in the air. This is really where the magic happens as far as electrostatic, the superior technology that's in the gun. So as some of my colleagues say, this is where the magic happens. And the droplet of each chemical is coming in, out, and each is individually charged. So you're not using extra chemistry, you're not using extra labor, you're actually saving significantly on the amount that you use. But the beauty about it is you're covering every single surface, up, under, below, and all through and through, which now takes away the challenge that I said earlier, where 50% of surfaces are often missed. So this becomes the beauty about this technology. This is a visual image. And what I would say is, honestly, if you have not seen this device in action, please reach out to me, and one of my team members can actually show you in a real life setting what this actually does. But this image tries to show you the difference between a trigger spray. So if you're looking at the image to your most left, that is an example of a light bulb that's been applied with a trigger spray. As you can see on the left, there's a splatter of chemistry, but nothing is hitting the right side. So it's now showing you what a trigger spray does. You have to go all around the light bulb to be able to apply chemical. With the mister, you get a bit more coverage, but you're also missing certain surfaces. With the last image to your right, you will see all around the light bulb, you've got a perfect film of coverage, which is really, as I say, the superiority of this technology, because wherever there is coverage, chemical is reaching and disinfection action is happening. So that allows you to now get that superior efficacy. So when you're now looking at this technology, this is really a slide that helps you to now determine what do you want to have in your facility from an efficacy perspective, in terms of knowing now that anywhere where chemical doesn't get to, any healthcare worker that now touches that surface is now liable to actually get more coverage and more surfaces and more contamination, and thereby more outbreak continuing to linger. Next slide, thank you. So where do you use it and how does this go? And I see Jennifer sent a question about N95 and how that's worn, and I'll definitely cover that as part of that conversation as well. That's a great question. So I'm going to cover that under the section of safety. But right now, in terms of where can you use electrostatic? Well, you can use it anywhere within your healthcare facility, in particular patient rooms, waiting rooms, patient transport equipment, exam rooms, dining rooms, any space that is large and that is hard to clean areas, and that's a lot of places. You can use it on your portable equipment in between patients. You can use it alone or as a finishing step for terminal disinfection, or you can even use it as a daily protocol for your washrooms. It's got so many applications and so many use. And as I've gone around the country, I've learned more and more uses that are emerging as users are using this in their spaces. So there's definitely so many uses that you can actually have in your facilities. And that's something that we can also provide. And we've got protocols that are laid out in terms of how to go about using this. But as you can see, there's definite indications that you can actually use it. Next slide. So here's something that becomes important, because as you know, with innovation and technology, there goes that time when there's only one device on the market to when there's 1,000 devices on the market. So this is meant to be a way to help you decide. How do you decide among the technology that's on the market? So a couple of things I want you to think about, right? I want you to think about the design, and I want you to think about the chemistry, and ultimately I want you to think about the safety. So as you look to a device that's coming to your facility, think about it under these buckets, and then think about how that incorporates into your practice. So as you think about design, some of the thinking is this something that is lightweight? Is this something that is ergonomic? Is this something that my team and staff can use very easily? All of them, and not just the one environmental service worker, everyone. It needs to be vetted across just the simplicity of use amongst all your team. As you look at the chemistry, you have to understand one thing. The electrostatic is an application methodology, but then at the same time, what are you running through that device? So you now need to make sure that the pairing of the chemistry and the device is done really well. And it's demonstrated efficacy and demonstrated safety. As you cannot just take any product from the shelf and run it through an electrostatic, you want to make sure that that testing and that proof has been done together and that there's a proven collaboration. So that becomes the chemistry and the paired trusted solution component. The third thing you want to do, as I said, is safety is paramount. And safety is looked at both ways. Safety on the worker that's using the device and safety for the people that are in that space. So as you're looking at all this, you want to make sure that all that due diligence is done. And that will definitely lead me, Jennifer, to all the discussions around the N95 and all that. But what we've done at Clorox is we've definitely looked at all those three buckets. And in the facilities that we've worked, we continue to reaffirm and make them feel comfortable that all this due diligence has been done as well. But you definitely want to be thinking about this as you're deciding on an electrostatic technology. Once you've decided that electrostatics is the way for you to go, another thing to think about is, do you want a corded device or do you want a cordless device? Each, as you can tell, has got its advantages and disadvantages, but it's definitely something to think about. And then at the same time, in the selections, you also want to be thinking about, do you want to go for a ready to use, which is no mixing, no dilution, ready to use, screw on a cap, ready to go? Or do you want to go with dilutable solutions? Each of these have their pros and cons, obviously. What I would say is, in that case, you also want to balance against the risk, the staff training required, and all those considerations. So as you're thinking about this, think about your particular unique scenario. And then if you have any questions, that's something that we can also help you to try and think about some of these frameworks and how they apply to your particular unique setting. Next slide. So I hope I made it clear that I think the important part here is you do not want to just be thinking about electrostatic technology as a device only or as a solution only. You want to be factoring in these three pieces, because these three pieces of device, the solution, become the system, and then you also want to factor in the operator. But ultimately, electrostatics is more than just device selection or chemistry selection. It's really about looking at it from a holistic perspective and seeing it as that system coming together. So what you want to definitely want to consider is efficacy and whether those systems, and in terms of chemistry and the device that you choose, are pairing together. You also want to look at the US EPA master label, or in the context of Canada, look at the DIN and make sure that the DIN is actually calling out that electrostatic application, because that now safeguards you and makes you feel comfortable that Health Canada or the EPA in the US in this case have done all their work, and that you should feel comfortable that you're not taking any chances. And then the other interesting piece that we've noticed really important is the surface compatibility. And for that, what we mean is, because now that you're applying chemical through a device, it might land on different surfaces. So is it okay if it lands on your keyboard? Is it okay if it lands on your computer screen? Is it okay if it lands on your stethoscope? What we've done on our technology and on our solutions is we've done what we call surface compatibility, which has looked at different surfaces that are typically found in healthcare, and we've tested them, and we feel comfortable that as long as the surface is listed on that surface compatibility, that you will be fine. And this is something that you also want to be thinking about as you're thinking about anything electrostatic, because the product is landing on certain surfaces. As it's landing on those, make sure that that surface compatibility work is done as well. The thing about our device is it's got 3 solutions that it's got available to it. So out of these 3 solutions, you're most likely to find what you need. If you need something that's sporicidal, we have that in the form of our product called Spore Defense. If you want a regular work every day for your COVID, for your MRSA, that kills in 2 minutes, we've got that. That's our quad chemistry. And then most recently, we've launched another product, which is our food safe product. It's the only product in Canada, to my knowledge, that has the ability to have a food safe disinfectant, no rinse. So that becomes important for your dining rooms and any place where you might have access to food preparation and things like that, because the chemistry itself does not need to be rinsed, and it has safety and efficacy that's actually tested and validated. Next slide. So as you look to this now, you want to also choose under the operator safety, because remember, that's the last piece around safety. We've done a lot of work, and you should also be challenging any electrostatic device that you have around the safety for the skin exposure and safety for lung exposure, because both of these 2 things determine a couple of key other details. And the important thing that you'll hear a lot here is re-entry time. So re-entry time is really when you have now applied chemistry in a room and the time that's required for you to be able to safely enter a room. There are devices such as the class we call foggers. Foggers, for example, could require the room not to be re-entered for up to 2 hours. The beauty about the electrostatic technology, in particular our chemistries and our testing, it's an immediate re-entry. What that means is as soon as you switch off your device, the room can be reoccupied. The beauty about that is when you're in an ICU setting or when you're in a long-term care setting and you need to occupy that space really quickly, then it allows you to have that confidence and comfort that you don't need to block the room, take a long period of time, and cause so much disruption. So this is something that then works out really well. And the beauty about this is, depending on the chemistry as well, we have chemistry that goes from needing an N95 mask to be worn by the applicator only if you're applying for long periods of time, all the way to no N95 or no mask needed. So we've got 3 different types of chemistries. Each of those have varying needs. But one thing that you will see consistently is all our system recommendation has the need to wear eyewear. And the reason for eyewear is in the case of inadvertently pointing the nozzle in your direction, then it's just meant to protect your eyes. So that's something that is stated in the directions for use and in the process. Next slide. Right, I hinted at this earlier, but I'll speak a bit to it here. One of the benefits you want to think about, or anytime you want to run anything through your electrostatic, ask yourself, is this safe for the surfaces? Because as we've talked about, safety is paramount. You don't want to go through thousands of dollars replacing complicated equipment in your facility. So you want to ask yourself, has it been tested against these surfaces? And we've done that. So we've got an extensive compatibility list on our 3 chemistries, and that is something that we can share, and it will help you as a decision maker or someone trying to make a decision in your facility to say, listen, can I use it on this? And then you can just quickly go on and then you can take a look. The beauty about our surface compatibility work at Clorox is it actually worked with the partners that make most of those healthcare surfaces. And in that work, we tested multiple surfaces over long periods of time. And we came up with a very easy 3-star related program, where 3 stars means all good, 2 stars means you got to think about certain things, and 1 star means you got to wipe over the surface just to protect it. So 3 stars typically means good. And in the event of this particular product that we're looking at that's shared on the screen right now, it's looking at the spore defense, which is our C. difficile killer disinfectant. And in this particular case, it's got 3 stars all the way down on certain surfaces, including vinyl fabric, which makes up a lot of long-term care homes that have that surface, PVC, which is used typically in pipes, HDPE, which is that high-density polyethylene that's used in a lot of technology and a lot of surfaces that are on computerized and electronic systems. So those all come up with a 3-star rating, and it then just helps you to feel comfortable around the decision that you're making. Because as I said, you do not want to then lose a lot of money and lose a lot of cost related to having to change out your surfaces. So another thing to think about is, does the product smell, and does the product leave a residue? And this is important because when you're now, as I said, applying chemical onto surfaces, you have to be thinking about what is happening to that chemical that you're applying on surfaces. And there's many ways that this translates. There's many facilities that I've been to where they have used certain products and then they have actually damaged the surface by not following the follow-up process. There's certain products now, if you apply in a space and you now need to air it out for a significant period of time, and that has an impact that it can have on your people in your space, all this becomes consideration and things to think about. And as I said, by virtue of having those 3 chemistries, we can actually make a custom-made solution and a strategy that allows you and your facility to have a safe, odor-free or odorless environment that is patient and that adds to the patient and staff experience. And this becomes something that's important to consider. And all of our products are scent-free and are using the natural scents that come with them. And this is just, I like this image because as you can see, might be bad resolution. I'm not sure if you can see it well on your screens, but what you see here is on a surface that's being wiped, you see the surface closest to the worker is very clear. It almost looks like a mirror. Everything else further away has that streaking and surface that comes on. Most wipes, most disinfectants have that, and that is normally related to the surfactant or to the soapy configuration that comes out of the disinfectant. But what you want to always do is you want to make sure that whatever you have is also good for your surfaces. And that's the kind of surface compatibility work and the odor and residue profile that we can also support. And we have a lot of extensive information on. But think about that as well when you have any kind of product that you're looking at bringing into your facility. The other thing you want to think about, and this has come up so much, like I was talking to Donna and the team earlier, and I was telling them that like one of the things that we're seeing now is we're seeing some of our technology going into non-healthcare spaces. And healthcare has always appreciated the value of a contact time. It's the same thing as anything else we do in healthcare. It's timed, right? It's like a medication needs a certain time to work. Like all your work is based on some sort of time. So when it comes to disinfectants, contact time is important. That is the premise in which it's guaranteed to work. So when Health Canada writes on a product or asks the manufacturer to write on a product that it takes X time, that is the time that you have to keep wet in the clinical setting. If you do anything less than that, then you're bound to not meet the same kill claims that are stated on the label. So this becomes very important, especially now. Many hours are spent trying to educate people on what contact time means. So you want to look for it on your disinfectant. If your disinfectant is a sporicidal, the contact time in our case is 5 minutes, but you want to see if it's a 5 minute or less, because that's really the more realistic time that you can actually get to stick around on the surface. If you're looking at killing COVID and other common pathogens that we're facing now, a contact time of 2 minutes or less becomes what you're looking at. If you have anything that's calling out 10 minutes, it's very difficult to keep that surface wet for that time without reapplying and then wasting time of the applicator and wasting time saturating surfaces and really leading to damage. Because if you have to keep a computer wet for 10 minutes, that means you're almost soaking it in disinfectant, and that's going to affect the way it works. So shorter contact times, the better. So make sure you're checking your contact times. Make sure you are achieving the compliance, because this is exactly what accreditation and all these Ministry of Labor is coming in to take a look. They're now coming in to take a look to say, listen, in your workplace, do you have the necessary contact time? And shorter is better. Next slide. So system design, I said it before, I'll say it again. Make sure it's easy. It doesn't require the worker to bend too much, to lift too much, to have their arm exposed too much, to work around the ease of use for the worker, and make sure that it's easy to share, and the design process allows that process. So this is a lot of the thinking that we've done. And if you see the handle that we have, it's adjustable. So it's adjustable so that the worker doesn't need to have their arm too high or bend over too much. So all this is really thought about, because the important thing we have to think about is our staff are cleaning for longer and longer. And because they're cleaning for such long periods of time, we have to figure out how to make it comfortable for them to work, as this is part of their day-to-day job. So as much as people now that are now spending so much time on Zoom meetings are having sit-stand desks, this is an important consideration. Whatever equipment you're bringing into your home, does it do the ergonomic assessment that is required? And does it make your staff feel safer and feel able to use it? Because the more they're able to do that, the more they're more likely to use the technology as it is designed. So changing gears a little bit here, I'm going to talk a bit about some of the studies and some of the evidence, because a lot of people would be like, hey, I hear all that stuff, but what does that actually do? What is the studies, what is published, and what's available? And I'm going to go a bit to talk about that over the next couple of slides. So let's talk about some of the studies and the information that's available. So Clorox has done, there is about 3 studies that I can speak to that have been done, but the Coles notes really is that we shared portable equipment served as a transmission vector for C. difficile in an ICU. And what we noticed in that situation is 85% of the wheelchairs found to be contaminated by bacteria, MRSA most of the time, and many other things. And then out of that, 30% of wheelchairs had more than one pathogen. So they had a combo of either C. difficile, VRE, and MRSA. And what we were able to see in many of these clinical studies is this is something that seems to be common to many, many different locations, but people don't have the time to get to some of those nooks and crannies and get to deal with this. And that's why I think the electrostatic bridges that gap. But this is definitely some of the study findings. And all this stuff, by the way, is available as part of the references, and it's also stated at the bottom, but it will be shared with the slides for you as well. Next slide. This is some information coming out of Public Health Agency of Canada. What Public Health Agency of Canada has actually said is make sure you're dedicating non-critical equipment to one patient. And this becomes important to do, especially when you're dealing with C. difficile and SARS-CoV-2 in the case of COVID. But when you can't do that, you want to make sure that you're having a disinfection process in between. That way that equipment can be shared. It's also calling, according to the Public Health Agency of Canada, for terminal and routine cleaning of patient patient equipment. And then it's asking for you to document, supervise, and monitor that disinfection. And lastly, it's saying use surfaces that can easily be cleaned. And the beauty about the electrostatic is all these requirements are checked off when you can actually wheel all your equipment at the end of a shift or at the end of the time when the residents are in their rooms. And then you actually put in your equipment room and then you apply all your disinfectant, you know you can actually check that box off. In the case of a physiotherapy room or an area where you're actually using shared spaces, once again, as soon as all the residents exit, once again, you come back in with your electrostatic, you run it through, you have like your checklist. That's something that you can now check off and say done. Without the advent of these technologies, some of those complicated physiotherapy rooms that are large rooms are going to be very difficult to do. Without this technology, equipment rooms that have 60 stretchers in them, 60 wheelchairs, 35 walkers. You can't get to every nook and cranny, but this technology allows you from the end of the room to really apply disinfectant on all this, and then this gets you to that efficacy and allows you to check that off because it's all approved by Health Canada and the Public Health Agency of Canada. Next slide. So we've also got a couple of different studies. What they've shown is when you use electrostatic technology and you combine it with our sporicide, it reduced C. difficile in the environment in a clinical study. And this study was statistically significant, meaning that the data was actually, we actually showed everything that we wanted to see. And it showed that on wheelchairs, waiting rooms, just the use of the sporicide alone with no pre-cleaning was actually good enough to show result. And this is actually timely because I see a question that's coming from Lisa Bray. And in our study that was done here, it actually showed that the wiping, as long as the surface was not visibly soiled, there was no need to actually wipe the surface in this particular study. That being said, the instructions that we give hospitals or anybody that's using the device, long-term care homes, is ensure that the surface is thoroughly clean, as in there's nothing visibly on there. So if you have a surface that's got juice, food, microbial matter, then the disinfectant cannot penetrate all that to get to the surface. So you want to make sure that's visibly removed. So that becomes something that's important. But in this study, they showed that whether you did that or not, it actually resulted in efficacy. But what I'm saying is in a clinical setting, you want to make sure that the surface is visibly clean. We also noticed that when you compare electrostatic application to a wheelchair, and then you compare that with manual wiping, this was 4 times faster. And everyone I've talked to appreciates the time savings. We're living in a very, very busy time. We're being asked to do more and more and more. And this is one of those few technologies that's actually coming in to address your time constraint. So it becomes very important to balance that out. And this is where this becomes an important piece as well. So it's 4 times faster, but it's actually very effective in terms of compared to like manual wiping. This here just shows you some of the studies that we've seen, and what it has actually shown is when you've used sporicidal, when sporicidal is used in a SARS-CoV-2 study, they've noticed that there is significant improvements all across the board. And the interesting part is the star bubbles showing the floor, the high touch surfaces, and all that outside equipment. Each of these areas had a significant improvement. And the key thing to take away from this is there are certain areas that we neglect because we don't typically have DIN registered products on certain surfaces. So I'll give you an example, the floor. The floor in healthcare settings, long-term care, in all these settings has now been studied and found to have things like C. difficile and even COVID. But the issue is half the time when we're disinfecting, we're either using a bucket with water or we're using a bucket with a very low concentration, which leads you to not being able to kill stuff that's on that floor. And it only takes a lapse in infection control for things to go awry. So when a resident is lying in bed and then their linen is dangling on the floor, that linen can then become part of what they touch, and then when they eat, all that leads to the cycle of infection. Or a care worker can come into the room, have their stethoscope, maybe it falls, and then it falls onto the surface, it gets contaminated with any of those pathogens, it becomes an issue. But what we've noticed is when you're using your electrostatic with the sporicidal applied as well, you can now actually cover floors very quickly. You can now cover additional surfaces. Because as I said in the very beginning, you're missing 50% of the surfaces at any given point in time, and this technology allows you to close that gap. So that is something that then becomes very beneficial, both in the room and outside the room. So this is a good information to that as well, and the studies are referenced at the very bottom. I just threw this one in really quickly because this was a study that I just was reading. It was a big study, actually. What they were looking at is the assessment of air contamination in hospital settings. This was a very interesting study. They set up a whole bunch of devices in a healthcare setting. And what they wanted to do is pull from the air and see where in the air is there most SARS-CoV-2, which is the virus that causes COVID. So what they did here is they compared all the samples that they found from many different settings, and 2 really stood out that were very problematic. So the 2 were the toilet and the bathroom, which is the one that's got the one of the higher graphs at the 10,000 reading, and then the staff areas were the two. So the issue there is your toilet or bathroom rarely occupied, but it's one of those areas that is very easy to disinfect and clean against SARS-CoV-2, because what's been noticed is when people go to the bathroom and then they flush the toilet and then that SARS-CoV-2 goes lingering in the air, that all causes problems. So when you, and if you're able to address just these two surfaces alone, this was the conclusion of the study, if you're able to just address these two surfaces alone in terms of the toilet or bathroom and the staff areas, then if you're doing that at a great enough frequency, you can reduce the air contamination and the reduced spread in your facility. So this becomes one area where I would say, if you're not using your electrostatic there right now, you want to be thinking about how can you incorporate it into that a little bit more. So that's something that is definitely a recommendation that we'll be giving in terms of where to go. And this comes from, as I said, an interesting study that was just showing where in which air, in which environment has the most COVID. And it seems toilets or bathrooms and staff areas become the most important ones for reducing spread. Next slide. So I hope I've tried to convince you. I'm obviously convinced, as you can tell, but I hope I've made a case here that electrostatic technology is a better way to spray. And I think it's better for a couple of reasons, from the simplicity, from the ease of use. It's Health Canada approved. It's got the various kill claims that are required. And it is a very good addition to what you are doing right now. And I think right now, based on our previous understanding, there's probably out of the 680 or so nursing homes in Ontario, about 1/3 of those actually have a device placed, and they are using a device of electrostatic capability. I see from the responses that were sent earlier that people are responding, they are using some sort of electrostatic. So this is something that exists right now in many different settings. But if you're not thinking about it, and if you haven't thought about it right now, this is something you want to be thinking about. And what I was going to do is just spend the next 2 slides talking about, hey, if the consideration that's limiting you from thinking about this is money or financial limitations, Clorox, we came up with a program that can allow you to be able to take advantage of this. And that's what I'll talk about over the next 2 slides. And then hopefully we'll have enough time for some questions and some discussion. So on to the next slide. So we came up with a program that we're calling Clorox Cares. It started February 1st, retrospective February 1st, but effectively we started it March the 1st, and it's running up until April 30th, 2021. This is a program, if you go to the next slide, I'll read it verbatim because I'll do the marketing team a disservice if I don't do it any other way. But really what we've noticed is as our world is still in the grip of COVID-19 pandemic, whether you're shopping for essentials, visiting outdoor, commuting, or going to school, daycare, everyone benefits from proper surface disinfection. And that's what I tried to point out throughout this slide deck. We at Clorox are in a position to help. Our leading edge Clorox Total 360 electrostatic technology, when used with Health Canada approved Total 360 disinfecting cleaner, it kills COVID, the virus that kills COVID, the virus that causes COVID in 2 minutes. Well, we want to make sure that these products are available to everyone, but we recognize that the upfront cost of adopting this new method of cleaning is something that can prevent people from using this. So we want to alleviate that financial burden. And we've created a bundle program we hope will be helpful to your organization. Next slide. Yeah, so this just highlights the device. Next slide, sorry. So for a limited period of time, as I said, until April, there is a free Clorox T360 that can be given to a home with a customer commitment on 2 years chemistry contract for 3 cases for a device per month, for a total of 36 cases in year 1 and 36 cases in year 2. This program is exclusive to our Total 360, the cart that you saw in the image, and is starting February 1st all the way to April 30th. The minimum device eligibility has been waived for long-term care settings because we realize that this is something that's very important in your setting. So we are actually offering up a free device for each long-term care home with the commitment on the chemistry. which, by the way, the 3 cases of chemistry is definitely way lower than the typical threshold that people need and go through. So you would easily meet that 3-case commitment. It's something that I would like you, if you have any questions, please feel free to reach out, and then we can facilitate any conversations there. We've worked with our distribution partners, and we can work on how to fulfill this program. But this program really is meant to help and provide a healthier life, healthier environment, a safer environment for the staff, and a safer environment for all our residents that are definitely in need of protection from COVID-19. And this is something that we have and is available till April 30th. So we're very grateful for the opportunity to be presenting it at this time to you. And I'm looking forward to hearing any questions you have over the next little while. But I thought I would just share that as well. And this is probably leaving enough time for questions and discussion. And I think I will stop at this point and throw it over to you, Donna.
Oh, great. Thank you very, very much, Barley. It's so informative. And, we never contemplated that in our long-term care settings that we would need this level of infection prevention and control. You've spoken about pressures on staffing issues. This is at the forefront, and we will continue to hear more and more about the need to meet and exceed new requirements around infection prevention and control, and making sure that we have tools that will take the pressure off our staffing levels, knowing just how challenging things are, and also appreciate that for many of our homes, we have insurance exclusion on infectious diseases now. So, anything we can do to keep our home safe. And I've learned in abundance over the last 45 minutes. We do have a number of questions. One question that or a comment that came up is whether you could address some of the images where you have the person using the product but not wearing an N95 mask.
Great question. I think as I mentioned, we have 3 different chemistries on the device, and these 3 different chemicals have approvals from Health Canada and also have SDS sheets that have different requirements. Consistently on any of our chemical, if you're applying for a short period of time, short defined as anything less than 2 hours, or if you're going through a set number of liters in a period of time, you do not, I repeat, do not require to wear any respirator equipment in the form of an N95 or anything thereof. That being said, in the case of our quat chemistry, if you're applying for a period greater than 2 hours, then in that particular case, you have to wear an N95 because that is now putting you in a particular exposure risk. So what becomes important is the risk assessment. And I saw some comments where they're saying they've trained their staff to wear an N95 all the time by virtue of what's going on with COVID and what's going on also. It becomes something that's good to do. But on our case, all our safety data sheets will be dependent, will now impact what you do in your home, and each of them have different requirements. Some have an N95 for certain indications, and the other 2 do not. So it is something that is going to be subject to which particular chemical you're using.
Great. Thank you. It's very insightful, just the complexities of how to use personal protective equipment and how all of these tools interface. We do have a number of questions with regard to recommendations for use in the kitchen and the dietary area, and making sure that we're using the right products in that environment.
Great question. What really happened that was very interesting here is when we started using our T360, one of the first questions that came up was like, hey, can I get something that I can use in my daycares? Hey, can I get something that I can use in my food area so that I don't have to rinse it off? So that was 3 years ago when we got this request. And as you know, Clorox is a chemical company. So our scientists and research and development focused really hard on this particular issue. And in the last month, that's when we came with this particular disinfectant called our Clorox Anywhere. This particular Anywhere product is Health Canada approved, has the necessary NSF and all the food safety requirements, that it actually checks off all those boxes, and you can apply on a surface and not have to rinse it off. So this becomes very important for your dining needs and all your other areas within the home, including any areas where you might be exposing it to food in the back kitchen. So this is something that we have really, really new and checks off those needs. So if there's any questions there in particular specifications, we can definitely share any of that information so you can have it as well. But very, very new, came from the feedback from people like yourselves, and we just got it started last month.
Great, thanks. There are a number of questions too around residual chemical. So I'm going to bundle these. So what if any residual chemicals left on the surface that has been sprayed? How do we secure a surface compatibility list? There's a question as to whether the surface is wet or will remain wet or moist. And then the other question is, do you need to perform mechanical cleaning before electrostatic spraying if there's no visible soil? So, you know, some real themes in this little
Love
bundle
it.
of questions.
Look at you, Donna. Like, look at you theming them and bucketing them like that. That's awesome. So let's tackle this. We'll call this the surface section. So generally speaking, anything that you have on the surface, right? If it's visibly soiled, definitely you want to make sure that you wash it off. If it's not visibly soiled, based on all the data that we have, no need. So that's one key piece there. The other thing that you also want to be thinking about is when you have any one of those settings, it has to stay wet for the required period of time. So remember, I told you time is important. So if it says stay wet for 2 minutes, it's got to stay wet for 2 minutes. Or if it says wet for 5, it has to stay wet for 5. Fortunately, in normal room temperature conditions, we've tested our products and we know they can stay wet, and we know how you can apply it in such a way to achieve that means. So that's something that we know. That being said, you definitely want to make sure that that wet for that period is definitely met. So hopefully those are two of the themes that were there under the surface questions.
Yeah, I think that's great. And there's a question around aerosolization. So the participant noted that they'd been advised to avoid spray bottles for cleaning as they can cause spread of infection. How does electrostatic how does this new technology compare with that in that sense? Does it cause aerosolization?
Great question. So I think in that particular case, what people are looking at is when you are applying onto a surface, if you're spraying, then those droplets linger in the air, and then somebody walking into that space can then smell them and they go into their nose and such. And this is an example of like when you use Febreze or any of those air fresheners, they linger in the air and you can see the little droplets, right? And then that's why it smells good when you walk into it, because you're walking into that whiff of chemical. The difference with our electrostatic is, as I showed you with the magic of the gun, every single droplet is charged. So it can't stay long because it's being pulled down with a force greater than gravity. As a result, there's nothing to linger in the air. That being said, I've talked to a lot of academic hospitals that are providing support to long-term care, and we are working with some of them to try and come up with some studies that can do more research in this area, because Health Canada has approved our product as per the use. But I think some of the concern is like, hey, what else could be happening behind the scenes? And that's why in our case, wearing the mask becomes important. And we're also working on a couple of different strategies. But if you have any particular question or if you have any challenge that's coming from any particular site or location, feel free to reach out to me, because this might help to the studies that we're trying to continue to do, because we appreciate that this is an area that continuously changing, and we need to do more research in this area as well.
Well, and that's a great segue to the next question with regard to some of your research where you look at the higher rates of infection and the prevalence of the pathogen in washrooms. Did you do a breakdown of resident washrooms or public areas?
Yeah, no, actually, so on the study that I showed, which was Journal of American Medicine, they actually didn't break it down further to see what's going on. But what I do know is I actually know some anecdotal information. And what I know is, and I'll give you an example of this. In Ottawa right now, Ottawa and some places in Alberta are leading the way in terms of doing what they call wastewater COVID testing. So what they're doing there is they stand on the corner where all the sewage is coming from a particular neighborhood, and then they run a test and they see if there's any COVID there. What they're noticing is the wastewater is actually a good predictor of COVID that's in the community. What that means and what that applies to this particular case is, regardless of a public washroom or a hospital resident washroom, both of these are being found to have some of that COVID in the sampling. So what it does is, regardless of what washroom you have, you need to be cleaning it at a frequency of every 4 hours. And this is the direction that's given through Public Health Agency of Canada and so on and so on. Before COVID, by the way, it's really looking at those hospital hotspots or those long-term care hotspots, whether it's a resident or a patient requiring that frequency of disinfection. So it has nothing to do with who is using that washroom. It has more to do with COVID seems to be found in fecal matter. And as it is found in that, it tends to stay in those surfaces unless if you do some sort of intervention. And this goes into a C. difficile as well as other pathogens that we know linger in the environment, particularly in washrooms.
Oh, great, thanks. So two pieces here. So did you do any studies in long-term care? And I think clearly there's an opportunity for more if you have. And one of the questions sort of links to that as well is where hospital and public health partners did not allow long-term care homes to use the 360 machines because of the risk of spraying or aerosolization. So, I welcome your thoughts on that, given your earlier comments, and how do we educate those who are here to help us, especially given that we know that this technology is being used in hospital settings.
Absolutely. My standing answer when I talk about adoption in healthcare is it takes about 17 years, according to studies, to adopt innovation into healthcare. This is a technology that is about 3 years old in this space, and we know we can't wait another 14 years for adoption. What we've done at Clorox is we've worked with, we've done a couple of webinars, such as the one you're on right now with IPAC Canada. We've also done some with Health Canada to raise more awareness. So we're doing a lot of awareness work to make people realize that this technology exists. And then as we explain the science to a lot of the stakeholders, we're seeing a lot of interest and acceptance. And that's why I think we led to the donation with the Ministry of, with the Premier's Office for Ontario. That was really aimed at really continuously raising that awareness. But what we definitely realize is more research, the better. More communication, the better. So if you can connect me, if you have anybody that's like pushing back, or if you're running into some challenges, most of the time it's a phone call. And through that dialogue and through that discussion and sharing data, they feel very comfortable, because most people feel that this is not Health Canada approved, yet it is. Most people feel that it doesn't have a DIN, but it does. So there's a lot of like concerns around some basic fundamental stuff that we continue to have to educate on. But I think it takes a village, and I think it's just going to be one of those where call a friend. In this case, this is your friend. Reach out, and then we can continue to answer those questions as we go.
Oh, that's great. Barley, this has been really engaging. I want to thank all of our participants for your questions and comments. We did get a comment on the need to educate the public health units as we go forward. And then we did get a comment from Jean Clark, who said that when they were challenged in using the technology, they told the public health that we continue to clean and disinfect, and that this is an adjunct. It's part of a larger infection prevention and control protocol. It's another tool in the toolbox. So thank you, Barley. Thank you so much, Bilal, as well, for your leadership and educating us. I think this does show, I think, to Barley's comment, this is new technology, yet the disruption of COVID-19 and the pandemic has shown that we need to respond. We need to respond quickly, and we need to look at how we're going to adopt and adapt new technologies in support of our safety, and including as we look at how vaccines evolved over the past year. We did not have a vaccine a year ago, and here we are with great hope. So really want to thank Clorox for your support in making today possible, for sharing your depth of knowledge and challenging us to better understand how to do better infection prevention and control, for introducing us to this extraordinary technology as we learn more about it and how to use it effectively and support one another and in sharing these stories. And I do want to remind everybody that we do have Together We Care virtual conference April 20th to 22nd. Registration's open. OLTCA hosts this in partnership with ORCA, and this year's focus really is about how we can work together to support our aging population in the COVID environment, but beyond COVID, and as we think to the future. So thank you so much. Be safe, everybody, and enjoy the sunshine. Take care.
Thank you.